is Awani Tonight. Government may allow people to choose vaccines of their choice. And can a decentralized approach help turn the tide against COVID-19? That's coming up. The AstraZeneca COVID-19 vaccine will no longer be an opt-in, but will be part of the national vaccination drive. Vaccine Coordinating Minister Khairy Jamaluddin said the opt-in option was initially introduced given public hesitancy to take the vaccine after reports of blood clots. But due to good response, the vaccine will no longer be an opt-in. Now, this does not affect those who have registered previously, including individuals who signed up yesterday. Only the next AstraZeneca shipment will be included in the mainstream program. Khairy also said the government is reviewing the possibility of allowing people to choose vaccines of their choice via MySejahtera, which will be upgraded soon.
On the choice of vaccines, we are still working out the method to which we will do this. It will be done through MySejahtera. I think we've learned a lot of lessons on the website, and I think that it's cleaner to do everything on MySejahtera, and it encourages people to use the app, because I think it's better for us to encourage people to use the app. We will be looking at how you choose your appointments, place, date, as well as vaccine. I think, if anything, we want to make the process as easy as possible for people. So we're working on a few options right now. I will probably announce that over the next couple of weeks.
For those who have failed to secure vaccine appointments yesterday, do not fret, as the government has managed to secure early deliveries for vaccines. It also aims to ramp up its vaccination rate to achieve 150,000 jabs a day in June. According to Khairy, an agreement was signed for a further 12.8 million of the Pfizer vaccines, with more than 25 million doses to be received by the third quarter of the year. Meanwhile, for the month of June, 2,223,000 doses of the Pfizer vaccine will be received, with 444,000 will be sent every week for 5 weeks. As for agreement made with Sinovac and Pharmaniaga, 12 million doses of the Sinovac vaccines will be received in June and July. The government is also expecting further AstraZeneca vaccines pending approval from the NPRA for the vaccine's manufacturing factory in Thailand. Malaysia reported a record number of new COVID-19 cases for the third straight day, with 7,857 infections. The Klang Valley area accounted for about 40% of the new cases, with 2,675 cases in Selangor and 561 cases in Kuala Lumpur. 59 deaths related to COVID-19 were reported in the last 24 hours. According to Health Director General Tan Sri Dr. Noor Hisham Abdullah, nearly 17,000 active COVID-19 cases in the country are those originating from the workplace. The country is also faced by the emergence of clusters linked to Hari Raya as well as interstate travel. Health Minister Datuk Sri Dr. Adam Baber said level 4 and 5 patients have increased to 15% in the third wave compared to 5% previously. The government may start imposing fines on those who do not show up for their COVID-19 vaccination appointments. Health Minister Datuk Sri Dr. Adam Baber said his ministry is in discussions with the National Security Council regarding this matter after reports emerged that more than 50,000 individuals across 7 states have missed their appointments to date. In a virtual press conference today, he said applying penalties and mandatory vaccination must be implemented once all voluntary avenues like online registration, by MySejahtera or doing face-to-face appointments fail. Adam said more vaccines are set to arrive in June and July, following which he feels the vaccine rollout process will be smoother and faster. Utusan Malaysia reported that more than 52,000 individuals had missed their appointments nationwide, with Kedah registering more than 20,000 missed appointments. The AstraZeneca opt-in registration yesterday saw nearly 1 million doses of vaccines being booked in just 90 minutes. While CARI today announced that the vaccine will now be included under the national vaccination drive, should the government consider the opt-in method again to speed up vaccination rate? We speak to Dr. Muhammad Farhan Rusli on expediting the vaccination process.
The reason why certain vaccines can't be opened up like that is because due to the logistics that actually has to play a role. So when you talk about Pfizer vaccines, they can only be given at certain locations, and it has to be set because due to the cold chain that needs to be monitored really aggressively. However, I've been saying this many times. You should use the opt-out method. Why not you just give all the entire population a date for their vaccinations according to their risk, and then after that, if they do not want to get the vaccines, they can opt out. So the reason why is because I think a lot of people do want to get vaccinated, but if they do not want to get vaccinated, they will have to go through a process to get themselves out. So we do not want this thing where you allow people to opt in, but only for certain vaccines. And for other vaccines, you have to wait for your turn. People are confused. Why is this vaccination not part of the immunization package? So then you think, if this is not part of the immunization package, should it be allowed or should it be counted as part of the herd immunity? Are these results published? So I think it's time we just say that whatever vaccine that's available should actually be part of the national immunization program.
Dr. Farhan also suggests for people to be put on waiting lists to avoid wastage of vaccines.
I think, number one, you have to remember that you cannot waste any amount of vaccines that you have. So you should always prioritize the groups that need to get it first, so the high-risk groups. But at the same time, you have a waiting list of people who can actually make it to any vaccination centers at the back and call. So this way, you don't waste the dosages. This way, you ensure the first priority is actually given to those people who actually deserve it. But at the same time, if they are not able to come and show up, the vaccines are given directly to those on the waiting list. So this should have been the approach. And I think that when the AstraZeneca vaccine was actually opened up for 60 years old and above, and the 1 million doses were not actually taken up by all the people as what they expected it, we have to see what was the reason behind it. Definitely there is a gap that we must address. Perhaps people who are 60 and above do not know how to register, because I am sure that there are more than 1 million people who are 60 years old and above who are still waiting to get vaccinated. They just do not know how.
We'll take a short break. Stay with us.
Raikan Raya ini dengan filem kegemaran anda on demand.
Hari Raya ni sebenarnya hari kemenangan.
Komedi.
Kami masuk geng. Kami ingat kami boleh glamour, Bang Jo.
Drama.
Jangan main gila.
Seram.
Semua bersalah.
Buka lembaran baru. Stream on demand di Ultrabox dan aplikasi Astro Go.
Are you ready, folks?
Paw Patrol ready for action, Rabbit. Untuk semua pelanggan Astro, nikmati tontonan komplimentari untuk pelbagai saluran kanak-kanak tertera. Juga di Astro Go sehingga 7 Jun.
I'm so excited.
Hiburan berganda apabila anda stream seleksi istimewa di On Demand.
Saya terpusing.
Well done, everyone. Duduk rumah, kekal selamat.
Welcome back. Staying on the national vaccination drive, a decentralized approach could help turn the tide against COVID-19. That's according to Kuching MP Dr. Kelvin Yee, who thinks that states can help complement the federal government's efforts in vaccinating the people if states are given more autonomy to make certain decisions.
On a national vaccination program, what I'm talking about is decentralizing so that the state governments actually have more autonomy, have more power to make certain decisions. Actually, based on the federal constitution, when it comes to public health emergency, it is a joint responsibility because it's on the concurrent list. So again, as I said, it is not a total decentralization, but the central body or the federal government must set common policy directions, and then the local state governments can complement their efforts with the local knowledge and also the local machinery. So this is like a complementary role, whether it is from purchasing of vaccines, providing logistics, maybe identifying high-risk areas, even allocations of vaccines and types of vaccines suitable for a certain demographic. So you see, the state should be given certain power to decide on considering the local context, including, in my view, vaccine appointments in rural areas, especially in Sabah, Sarawak, and even in Kelantan.
While calling for more autonomy, Dr. Kelvin suggests that the federal government can place safeguards to monitor involvement from the respective states in the national COVID-19 immunization program.
There is a possibility, and the fact of the matter is we have seen this in certain states where somehow this priority list or even standby list was abused, where we see maybe people connection or cable cutting the queue. So that's why it's important on the federal level they have safeguards in place to monitor and to mitigate abuses such as this. But in principle, as I mentioned just now, it is for joint responsibility, efficient implementation, and of course, reduction of bureaucracy.
Dr. Kelvin suggests the opening of Parliament and empowering each state's disaster management committee as the way forward in tackling current and future pandemics.
The government should open Parliament. This is where we need all hands on deck on this issue. As this issue is beyond politics, we need the whole society, whole of government approach. And this is not just Parliament, this is state assemblies. Right now, state assemblies are not even allowed to open. And of course, as I mentioned earlier, I think the second important thing is the federal government must encourage and empower each state's disaster management committee. Currently, there are only a few states that are actually more active in doing so. I can name a few, maybe Sarawak, Sabah, Selangor, and also Penang. I think moving to the future, especially when we are dealing with future pandemics, all states should be empowered to complement efforts from the federal government, especially to mitigate a public health disaster.
On to international news. Australia's second most populous state, Victoria, will enter a one-week lockdown, forcing its near 7 million residents to stay at home. This will be the fourth time the state returned to a lockdown since the pandemic began. The lockdown, which will begin at midnight, aims to counter a fast-spreading outbreak in its capital, Melbourne, where authorities have so far found 26 cases and identified 150 sites where people may have been exposed to the virus. The outbreak involved a highly contagious Indian strain, or the B1617 variant. There is growing anxiety over the outbreak, which reminds many locals of a devastating second wave that swept the state last year. Victoria accounts for 820 of Australia's 910 coronavirus deaths. The Chinese embassy in the United States said that politicizing the origins of COVID-19 would hamper investigations and undermine global efforts to curb the pandemic. This came after US President Joe Biden ordered a review to determine the origins of COVID-19 yesterday. Biden ordered U.S. intelligence agencies to report to him in the next 3 months on whether the COVID-19 virus first emerged in China from an animal source or from a laboratory accident. According to him, the U.S. intelligence community has coalesced around two likely scenarios but has not reached a definitive conclusion. A joint China-WHO study published in March said that it was highly improbable that SARS-CoV leaked from a lab in Wuhan, adding that it most likely spread from bats to humans via an identified intermediary species. China has repeatedly denied that the lab was responsible, saying the United States and other countries were trying to distract from their own failures to contain the virus. When children, through no fault of their own, are stateless, they fall through every safety net available. Tonight on Consider This, we speak to our guests on addressing this pressing problem. That is all we have for you on Awani Tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Cynthia Ng. We'll see you tomorrow.